Here's again a recap of our agenda for today. I'm going to introduce to you our two speakers. Our first speaker will be Marla Hollander, and she is doing our project managing the sustainability project. I know sustainability is very important to many of you, so you'll be interested in that. Talking about our strategic plan, we're going to be calling for new board members to increase the boards, and Beth Benavides will be talking about that. And we'll give you a brief update on the advocacy efforts around the FMCS issues, and then your questions. Okay, so the SDS Sustainability Project is an ARPA grant, and that is the American Rescue Plan Act. So that's where the grant monies come from through the federal government to DDA, and we applied for to DDA for a small grant to really begin the discussion about sustainability, and Marla will go into detail. Sustainability is the ability of a participant to continue self-directing as long as they wish to do so. And it has been a long-term advocacy focus for us. So directing the grant is Marla Hollander, parent of a participant who self-directs and health advocate and founder of Collaborative Strategies, LLC. So please welcome Marla.
Hi, thank you for that warm welcome, Patty. First, I want to share, I am so excited to support the SDAN team leading this new project that we are calling the Sustainability Planning Project. Next slide. Simply put, the project aims to address a significant support gap that would support people with IDD during a really crucial period of transition that typically occurs in the adult years as natural caregivers age. Next slide. And where those later years refer to adults with IDD who are out of school. And sustainability, as Patty shared, refers to the planning for the ability of a participant to continue self-directing in transition. Next slide. Over the course of the next few minutes, I'm going to do a quick project review for you, let you know how to get involved, and encourage you to share questions through the chat box that we will hopefully have time to get to. Next slide. But first, a little bit about me. I know a few of you, but I want to make sure everyone's comfortable with me leading this project, getting to know me a little bit. On the screen, you see a picture of my why I'm doing this work, why it's important to me. You see my son and my daughter who have taught me so much and keep me going. You know, professionally, I've spent a couple decades as a public health and marketing professional with experience working with numerous organizations and foundations designing and implementing programs that support healthy people and places. As mentioned, I'm a mom of a child with disabilities. That's my Ben right there. He's my real inspiration. Became a DDA waiver recipient in 2019, shortly before the pandemic hit, and I'm learning so much about how to do this and how to help him live his best life. I call home Kensington, Maryland. You know, the other side too, I constantly think about both of their futures, both Ben and his sister Lily, because they're connected as well. So we're also going to be joined. I've brought a couple other people onto this team because it's such important work that are going to serve to help inform the basics of our surveys, of our questions, everything that we do, and you'll get to connect with them, you know, later on. Next slide. So we have several phases of work, I think 7 to be exact. The first phase is really laying the foundation, getting us ready to dig in, getting our team and tools together. The project's, again, going to be supported by 2 of my team members who bring incredible inquiry-based learning and programming experience. The SDAN leadership will be advising every step of the way, as well members of SDAN and the broader IDD community. We'll share a little bit more about how that's going to work shortly. The second phase is really connecting to stakeholders. This is one of the ways that we're going to be reaching out to people on this call in the broader community. We're planning on pulling together 2 advisory groups. One of family advisory group that's really meant to inform efforts to identify what are the real life system roadblocks and core kind of planning pillars that are involved in maintaining services and supports. Like, what is it that happens every single day in order to maintain your self-direction and really start to document what those are so we can plan for the future. The second advisory group is one broader group representing people with IDD, their caregivers, service providers, care coordinators, government administrators, really coming together to provide broad community-centered feedback on an ongoing basis. Each of those groups we envision meeting 2 or 3 or maybe even 4 times during the course of this project, which is about 15 months, ending in March of 2025. So you don't have to be super involved at that level. We're going to be reaching out to the broader community as well in this next phase, the conducting research phase, which is really about putting surveys out, holding listening sessions to really really get that broader perspective on what the key issues are, to get feedback, do we need to add things to the list, et cetera, and to really pull together those experiences. I kind of just skipped over the environmental scan and literature review, the literature search phase, not intentionally, but what that really is really going to the scientific literature, the soft literature, out into the community broadly, not just here in Maryland, but nationally, internationally, to learn about what exists in terms of supports, what are people using, what are the systems that are in place that are working well, that aren't working well, to really inform recommendations on what we need to be thinking about for our Maryland community. And that kind of pairs with this next identification of those best practice models and emerging practices, right? Sometimes we don't see information in that research, in that writing. So, having conversations with other organizations, other communities across the country to see what's bubbling up, what are people doing that we might learn from. And then taking all of this information into the sixth phase of data analysis, really looking at it all together and developing some results and recommendations, proposed solutions. All right, next slide. Keep moving me along. Keep me on time, on the clock. There are 3 ways to get involved in this project. It's applying to serve on one of the advisory committees, participating in surveys, and participating in listening sessions. I will put a link in the chat box momentarily for you to consider serving in any one of these capacities. Just take a look, fill it out, and let us know your interest. Next slide. Again, questions, if you've been thinking about things you want to ask, put them in the chat box. We will get to them at the end of the meeting or respond via chat. And I think I am now transitioning this back to you, Patty.
I got it. Thank you. Thanks, Marlon. Sounds wonderful. I hope lots of people want to get involved because people really have thoughts on this, on sustainability. It's probably first in many people's minds. Okay, let's welcome Beth Benavides, a dear friend of mine, a colleague. She's a parent of an adult son who self-directs, which is wonderful. And you can see other accolades. She's been right there alongside of me since the beginning with the Ethan Saylor Alliance for Self-Advocates as educators. So really treasure Beth. So without further ado, Beth, you want to take it?
Yes, thank you so much. Hi, everyone. It's my pleasure to be here today to talk to you a little bit about SDAN's growth and expansion and some of the wonderful strategic planning that they've been doing. I was so honored to be invited by the board to meet with them as they took on these important topics of sustainability and growth. And I've been a member of SDAN since my son transitioned at 21. He's now 25. Kyle's 25. And I know firsthand that his transition to self-directed services was helped and well supported by the knowledge of this group, the expertise, and just the advocacy over the years of SDAN. We couldn't have done it without them. So I'm so happy to donate my time to this planning. So we have started, as all strategic planning does, by looking at such things as the vision and the mission. We've reaffirmed that SDAN envisions people with intellectual and developmental disabilities living self-directed, fulfilling lives with access to all the long-term supports they need, services and supports they need. As for the mission statement, also reaffirmed, it's to advocate for participant choice, control, flexibility, and the sustainability of self-directed services and supports. So SDAN does this through education, training, legislative advocacy, maintaining partnerships with state agencies and divisions, and collaborating with organizations committed to supporting people with intellectual and developmental disabilities. So as always, participant choice is front and center in all that SDAN does and all of its advocacy. Okay, next slide. So at each meeting, you know that SDAN often will put little surveys up about DDA or about the FMS systems. So I'm going to actually ask you to take a couple member polls for me. Liz is going to put these polls up for everyone to answer. And I'm just interested to know, when you attend these meetings, do you learn something new from SDAN? And it's just yes or no. Do you consider SDAN a reliable source of information? And do you understand that SDAN advocates first and foremost for the individual at the center of their plan? So these are all just yes or no questions, and these are not going to be shared here. They're just for our information as we're doing some of our strategic planning. So once you answer and submit your answers, the poll will disappear. Okay, so on to the next page. Okay, so we also looked at the core values of SDAN, and these are important for all of you as members to know and really to just understand what SDAN is representing. So each person has a right to a self-directed life. All people can self-direct their lives when given the support they need. The person at the center of the plan is the priority and the leader. The participant, their family, and their circles of support are all respected members of one team. All people have a voice in where they live, who they live with, and what they do. And people have the ability to design their own lives. So these are the core values of SDAN. And then we took a look at the board's current strength and assets. You know, we're looking at what the board currently has, where their strengths lie, where some of the gaps exist. But we know the strength of SDAN is the depth of the leadership, the expertise from the lived experience of the board members and the members that participate, the knowledge of leadership, demonstrated successes. I mean, there are many. If you just go to their website on that first page, I'm always telling them they should be screaming from the rooftops all that they've done and all that they've accomplished. on behalf of people self-directing services. And they just have so many demonstrated successes. Connection to community awareness. They know what people need to hear. They know what information we're missing. They ask the questions that we're all thinking. And then, of course, they produce videos to promote the vision of self-directed services. And that's been quite helpful as well. Okay, so the 2-year strategic plan goals that we have narrowed down on are strengthening the organizational structure, expanding the visibility of SDAN and its membership, strengthening the voice of people with disability and their families, so that's through continued advocacy, and then, of course, educating the community on self-directed services. So these are the 4 main areas. We have lots of different tasks underneath each of those, but just so you know, this is where the focus will be in the next couple of years. And as you can see, it's going to take some expansion. The current SDAN board is very small but mighty, or mighty but very small, and it needs to expand. So we are going to be putting out a call for board members. Anyone may apply to become a board member. In particular, the members that we are seeking are persons with a developmental disability who self-directs, parents, guardians, or family members of someone that is self-directing services, support brokers, registered nurses with experience working for people who self-direct, or other persons with relevant skills and experience. And so that board member application is now up and on the SDAN website. If you have questions, you can certainly email the info@marylandsds.org. Just so you know, this is a working board. This is not a governing board where they have a whole staff of people doing the work behind the scenes. This is a working board. And so there is an expectation that monthly meetings will be held, or committee meetings will be held regularly. There are going to be at least quarterly board meetings. But we really do want SDAN to be strengthened, to have more people involved, more people sharing the workload, and really just helping SDAN catapult further. So please, if you're interested, do sign up, fill out that application, and hopefully the new board members will all be interviewed and then onboarded, and we'll have new board members by January 1st. That's the goal. Then we're also going to be putting out a membership drive. So as you know now, currently there's a SDAN Facebook page, there's a mailing list, and that's really how we get the SDAN numbers. There's over 1,200 people that are participating regularly with that SDAN. And so we are going to, in January, really formalize that membership. And it's important for the organization to do this at this point, just because the organization has grown so much. And really, it will help the organization define who the members are, who the community is that it's serving. It'll strengthen in the advocacy efforts and definitely help with the grant opportunities. And as you can imagine, I mean, this is an all-volunteer board right now. If there's any move to bringing in office staff or administrative staff or anything like that, then we are going to need grants in order to do that. And so really, we have to define who the membership is. So in January, we'll be putting out information beginning in January for our membership drive. And to become an official member, you'll have to complete a membership form. And it's just going to capture basic information. There will be a nominal annual membership fee. Again, it will be very low. But the great thing is that we're telling you about it now, and we'll continue to tell you the first 3 months. If you become an official member in the first 3 months, then there's no membership fee for that first year. So we're hoping just to move all the 1,200 and some people that we currently are engaged with, that are currently signing on to meetings, that are currently taking advantage of everything that SDAN is putting out. We hope to just have you fill out a membership form, become an official member. There won't be any fee to do that, as long as we get everybody signed up between January and the end of March for the next year. So we'll keep you posted on those details as they come together. Again, we really do look at this as just a way to continue to strengthen SDN. It's quite often asked when you're meeting with legislators or others, who are you representing? And this will help us to really define who you all are and who's being so well supported by SDN. So thank you for this opportunity just to bring you up to date on a few things that SDN is working on as a board. Again, it's been my pleasure to work alongside them and to help them with this growth. And again, thank you, SDAN, for all that you do for our families and for participants.
Thank you, Beth. Thank you, Marla and Beth, for spending your time leading up to this over the last few months and then being available today to be introduced to all of our members, or at least those that could attend. So next, we're going to move on to the FMS updates and our recent advocacy efforts. And so Alicia is going to take this if she's available. Alicia?
Hi, everyone. Yes, I am available. Had some interesting things happen here at home this morning, so you may hear some interesting noises in the background, but I'm delighted to be with you. And again, our thanks to both Marla and Beth for their presentations. I know FMCS issues are in everybody's mind, so we wanted to make sure we kind of went through what recent FMS advocacy we've all participated in. SDAN has been sharing all of the concerns that you've raised to us. We are having weekly meetings with DDA and members of the rapid response team that was formulated due to our stakeholder input. We have met with the MDH Secretary Laura Herrera-Scott and her Chief of Staff. We've attended some small work groups, most specifically on September 28th that DDA and MDH sponsored, with the intention of coming up with short-term ways to improve the FMCS system and the reliability of it. Again, long-term collaborations with DDA, and we have noticed in the last couple of months a pretty good seismic shift in terms of interactions with the new administration and the reorganization of the DDA headquarters. And then lastly, just want to thank you again for filling out the member surveys. Those have been very informative, not just to us, but also to DDA and MDH who are following along on this ride with the FMCSs. So results of all of this advocacy. Finally, we have MDH and DDA acknowledging what you've all been saying, that we had a very difficult and poor rollout, and the result was just a detrimental performance by both of the FMCS as well, all three of them originally. But your advocacy, so on the bright side, your advocacy has helped to establish this rapid response team. It is sometimes slow, but we are seeing them work to improve and get the invoices and payrolls straightened out. The data does show an improvement on both FMCSs, both in the age of the invoice and then the number of payroll errors. And DDA's data is supported by all of our information from you guys. The number of complaints and issues has been reduced substantially, which is not to say that it's over, of course. There has been some faster response to tickets. DDA is working on system improvements and education and training, which we hope we'll see some evidence of in terms of training and troubleshooting shortly. And I feel like there's a start of better FMCS communications. Again, we have to continue our advocacy. It's not over. A lot of you still are having difficulties with payroll, with access to the electronic systems. But I wanted to ask of you, if you do have issues, it would be awesome if you would use the various systems, the ARC's ticketing system and GT's notification systems, I guess phone and email, to let them know of any issues that you are having. And then within 48 hours, if those issues have not been resolved, to email the rapid response team, which I think we've put the email address in our chat, but we'll do it again in a moment. It's important to let them know, because our only concern is they can't fix what they don't know about. So please keep them on their toes, keep them up to date and what the issues are that you're still currently facing. Next slide. So there's two issues that affect a much smaller number of participants, but they're important issues, and wanted to touch base because there's certain people who have felt this deeply and have been in contact with us about these two issues. So the first one is the FMCS 14% fringe issue, which is kind of an odd title, but essentially live-in caregivers who are using the difficulty of care exemption. Essentially, you put in the 14%, you budget for that for taxes and various fees having to do with payroll. And if you do elect the difficulty of care option, that means that approximately 8.5% of that 14% that's being withheld isn't used to pay taxes, and so remains then in that budget category. History had been that 8.5% had been available for the participant to move into another category to use as funds for that year. Of late, we were told that the FMCS thought that they might be able to keep that 8.5%. So we brought this very important issue to DDA, specifically to Nick Burton, who's the Director of Programs at DDA. He has now spoken to the Assistant Attorney General, and they are following up with their legally and consulting with their other state agency partners. So there's been a legal review, and we should get an answer on this shortly. I've been told probably within the next 30 days. So stand by. We realize this is a very important issue to you all, and we're letting the process roll through, and hopefully we'll get the answer we are hoping for. The other issue that's come to our attention is that several instances of FY23 invoices and expenses, some payroll, some invoices, some reimbursements, have been paid out of a fiscal year 24 budget. And our concern, your concern, is that will leave a shortfall in the current fiscal year budget. So progress is being made on this issue as well, and we expect to get a communication from DDA shortly. So stay tuned. And again, many thanks to all of you who have brought these two very important issues to our attention so that we could advocate on your behalf. So hang on, I think help is on the way. We'll know in the next month or so. Next slide. I think we're at the point where we can start answering some questions. So Carol, would you like to start us off?
Yeah, I only see two questions, and one is it's gone. Hold on. It's about the admin. How does sustainability relate to the new DDA role of administrator? And Patty's agreed to explain that.
Thanks, Liz. So that's a good question. How does having the admin hours available if you have that in your plan or budget relate to sustainability? Well, actually, it was the genesis of it. So a couple of years ago, some of you remember that we had a long and involved legislative work group when we were working on getting the Self-Direction Act passed. We were at that point in time, we were discussing and wanted to put into the act the ability to have hours of personal supports in a person's budget that were not for direct care, but they were for the coordination, for the glue, for the admin things so that when a person no longer has the person that's doing that for them, that their self-direction would actually be able to continue. That when the person who's holding it all together is no longer available to hold it all together, you would be able to use admin hours in conjunction with support broker and personal supports and CDS staff to cover all those bases. So that's how it was envisioned, and that's how it became available when the Self-Direction Act passed. Now everyone has the ability to put admin hours, which are non-personal, non-direct care hours, into your plan if you can afford it, if you have money in your budget in unallocated funds to do it. So that's a really big step that Maryland took that many, many other states wouldn't even consider having available. And the intent of that was looking down the road at sustainability.
Okay, thank you, Patty. And the other question was, how do you access the GT notification system and self-directed advocacy network? I guess that was Liz. Put the address in the chat, and it's oh, there's a phone number too. So if you look in the chat, but it's customer service at gtindependence.com, and then the phone number is 877-659-4500. All right, now there's more questions.
Hold on a minute, Carol. I think people were confused by the terminology, assuming that there was something that was actually called the GTI notification system. That is not true.
Oh, right.
There's nothing that is called that. It is simply how Alicia referred to the way you interact with GTI to get problems solved.
Right.
ARC has the ticket system. GTI has phone call, hang on for 2 hours while you're waiting, and various other ways that you get in touch. So there is no thing called the GTI notification system. That was just terminology used.
Yeah, I just want to reiterate again, if you run into issues with GTI or ARC after trying to contact them and you still are finding that neither are responding to your issue, that's where you would email the rapid response team. We meet with members of that team weekly. Every morning they take all of the emails they've gotten and they distribute it to members of the team who go forth and attack that particular issue. So I will say sometimes the rapid response team will get your email and you may not hear about it for a bit. But I feel fairly confident in saying that they are divvying out the issues to this. I think there's 6 members, and those members are contacting the FMCS. So you may hear from the rapid response, you may hear from an FMCS person to resolve the issue. So I wanted to just encourage everybody to please use that system so they have all of the data of what is missing.
So somebody said, what is a bit? I think that they're considering 48 hours. 48 hours when you make your first contact to either the ARC or GT, and then you can contact the rapid response and then give them 48 hours. If the the question says, what happens if the rapid response team is not responsive, then let us know. We talk to them every week. We'll, just bring it to our attention.
Carol, what many people are experiencing is, and that we're certainly seeing this as a vendor, is the rapid response team is very busy behind the scenes. They aren't communicating to us. So we know by evidence of things getting worked out that they're doing the work, but they aren't. That's what they're doing, is they're working behind the scenes to problem solve these big issues and not necessarily communicating to individual participants. We'd like that, but we're just not getting that. They're busy working.
Okay, so there's things are coming in pretty quickly now. Let's see. So we have in every meeting with the DDA, people that are working on this told them how bad the reports are, and the lack of reports on financial spending, and how it is almost impossible to track things. So we're continuing to bring that up until they get the payment issues resolved. That may not be on the top of the pile. Trivia question time. What is counseling fees? Okay, so when this contract was started way back in 2018, originally, they were going to add counseling to the DDA piece, and they were bringing in the people in community first choice. They are postponing doing that. That was supposed to happen now. And as Stan said, this is not a good time to do this. They agreed they're not bringing them in. They will get the opportunity to have counseling, but one thing that SDAN fought for was to not have counseling for DDA because that's the role of the support broker. And at that point, it sounded like they were trying to replace the support broker with a counselor from the FMS. So the C stands for counseling, and it will only apply to people under the Community First Choice program.
I just wanted to clarify a little bit that the counseling isn't, I think, what people wanted it to be, which is counseling, helping people learn about the FMCS system. It's not counseling on how to use their system, which we would refer to as education and training. The counseling was basically a replacement for support brokerage.
Right. So then who is pushing for CCSs and support brokers to have access? We are every single Monday afternoon, including yesterday. Supposedly CCSs will get that before support brokers, but it's in the works to have them have access to the dashboard. And that's because CCSs have a obligation to be monitoring that how people are using their funding, not using too much. It's not to replace the support broker, but it's just to fulfill their contract duties. And I'm not sure, I think I got everything else.
There was one other question I saw, Carol, and that was, is DDA searching for a third FMCS?
We don't have an answer.
Well, it wouldn't be DDA, right? First of all, it would not be DDA. It would be Maryland State, Maryland Department of Health, right?
Through their procurement.
It's a full procurement process. It's very legally heavy. So it's not something that the the DDA folks would be doing themselves. So
right. It
we'll
wouldn't
let you know when
surprise me.
we know.
Yep. It wouldn't surprise me if they hold off until things are a little more steady.
Somebody did comment about whether the FMSs are getting the money. It does not appear that that's the issue. We've asked that multiple times in multiple different ways, and it seems like they are getting the money. It's not a cash flow issue, but it's just the internal billing process hasn't gotten resolved yet for whatever reason.
I think there was one more about the 14% fringe. I'm going to scroll back and see if I can find that. Somebody was about does it mean that the FMCS is not allowing participants to move fund from tax system to other categories? Yes. Right now, that's exactly what it means. In the past, leftover money from the people who were claiming a difficulty of care, approximately 8.5%, what participants were able to move that if it wasn't used into another category. And at the moment, we've been told that that is not allowed. That's really the issue in a nutshell, and what DDA is working on. So we should hear back about that shortly.
I want to comment that sometimes we see confusion among members and participants that means family as staff having that difficulty of care exemption. And we want to reiterate again that is live-in caregiver as defined by the IRS difficulty of care exemption. So some of you really see the difference of that. And many times it may be a family member, but there are plenty of situations where a person has a live-in caregiver that is not family. So it's the fact that they're living in with the person you're providing the care for.
And there's also a second one, which is exemption for specific family members that work for the person, which would be a parent, a spouse, or a child. So that, and I think that one is the one where the savings is. The other difficulty of care is exempting people from their income tax, their impersonal income taxes.
Right.
This one, we're talking about the employer's portion
Right,
of
thank you.
Social Security and Medicare. So there's two different things, and someone told us we were using the wrong terminologies, that we have to be really careful. So difficulty of care is the income tax exemption, and the other one is special exemption that was created for Social Security and Medicare. I'm trying to read. There's a lot of questions. Does anybody else that are popping up right now? So if anybody else,
So one of the questions was, does SDAN have a position on the remaining 8.5%? And we have been advocating on your behalf to free that money up to move to other categories as per participants' wants and needs.
someone had suggested there should be 4 or even 5. There is no limit on the number of people of DDA in their last contract for the FMSs or FMCSs, said up to 10. They only picked 3, and that was maybe, who knows, the SDS Act says 3, a minimum of 3. But they did reject a couple of people who bid the last time for various reasons. And is there
We've been
any
told,
other-
we've been told by other people from other states and from Applied Self-Direction that there are not a plethora of companies in the country that do the FMCS business. So there's not just anybody doing it. So it might be limited as to who would be available and who would want to come into Maryland.
But I mean, there are some companies who made the decision not to come into Maryland who had previously bid contracts in the past. The Maryland system is very complicated because we have so many services and a lot of other things besides direct support now available to us, like PTO, like paying for training, like the admin position. So it makes it very complicated for the FMS, but that is their job. So it says, please restate the second topic Alicia reviewed after 14%. Some people have expenditures from the FY 2023. We're now in FY 2024. And the FMSs are processing them and paying them out of FY 2024. So we're working with DDA to make sure that that gets paid out of the right year.
It won't affect everyone because different people's plan years expired throughout the year, but anybody whose plan expired or restarted in July and had expenses, let's say, in May or April or February, old invoices that didn't get paid in that correct year, payroll that was mistakenly left out, any of those that didn't get paid, they might have paid it out of the following year's budget, fiscal year 24's budget, which started July 1st. So this issue won't apply to everyone, but it does apply to enough of us that it's important to resolve, because the worry would be that if you pulled FY23 expenses out of a new budget year, then there won't be enough in that new budget year to cover your expected expenses in the new budget year. I hope that clarified.
Okay, so someone is asking, what is the name of the advisory committee that focuses on family and waiver participant needs? I think that's you, Marla.
Yes, we don't have an official name yet, but there will be two advisory committees. If you look at the link to the interest form, one is labeled as family advisory, and one is labeled as stakeholder with definitions at the top. We may officially name them differently later on.
The other question was how many board members are we hoping to add? So Beth, you probably have that in your head. We have a top number. So I think, what did we say? If it wasn't for Beth,
yeah.
this wouldn't be happening. So thank
Sorry,
God for volunteers.
so the bylaw, right? So the bylaws show that SDAN can have up to 15 members of the board. Currently, there are 8, and so we definitely will be looking to add about 5 in this first year. We need to add people on thoughtfully and in a staggered fashion for sustainability. Yeah, but I mean, you know, if we get some really wonderful applicants, then we might be up to 7 more. But yeah, the bylaws go up to 15 board members.
I don't see any more questions. If I missed anything, please retype it.
I know there's questions out there. If please don't be embarrassed to put something in there. If you're thinking it, you know, I mean, we've lived long enough to know that many other people are thinking the same question. So feel free to stick a question in there if you, you know, you've been wanting to and just been holding back. So
I do see somebody asking about the best way to start self-direction. I would highly suggest that you hire a support broker. The DDA has a list of support brokers on their website. You can ask your CCS to help you find that. SDAN did a survey and asked some support brokers if they were willing to take on new clients. We can send you the list that we got from that survey, but definitely hire a support broker who, with your CCS, will help you form a team that will help you decide how to self-direct your services.
And there's also a support broker group, and they put their email in the chat. Happy to help at mdcs-sb.com.
Right. So there's some questions about the budget reporting. It was a specific question about their GT's accounting style and their budgeting report to show their transactions for their monthly fees. So I don't have anything on that specific line item, but SDAN's been advocating for clearer, readable, understandable budget reporting. And we did yesterday, and we will continue to do that, because I think all of us are having difficulty reading the reports, knowing where we are. And of course, if you don't know where you are in each line item category, you might run out of money. So that is definitely an issue that is foremost on our mind.
Okay, well, if there's no further questions, there are links in the chat for you. You can do the info@marylandsds.org if you have a specific question about things that we've talked about. Application, if you'd like to apply to be on the board, is on the website. The website, forgive us for some things, the website, there are some things there that need to get updated, but there's also some very wonderful information on our website that is not time specific. And we will get around to, and maybe a new board member will be really good at maintaining websites. So please, if there's anything else, put it in the chat. And then if not, we're going to end, and we're actually ending a few minutes early than normal.
So I saw somebody ask for the list. I wrote your name down, or the support brokers will send that to you. Somebody did note that for the first time, no one has complained about Evie, which is a major improvement, which is very much worth noting. So would anyone know who within GTI is a decision maker on reporting system? We know we have a contact with GTI, but I'm not sure I'm not sure. Does anybody know a name for GTI that we can share?
I mean, we've been in touch with Kirsten Kaplis there.
Yeah.
And we will put the board. So remember, the board member, to become a board member, the application is going to be on our website. That's marylandsds.org. And we'll also try to post the interest form for the sustainability advisory committees on our website as well.
Okay,
Yeah.
two people who asked for the list of support brokers, Vivian and O'Donna, and we'll email them to you because I don't have them right in front of me to put the link in the it would take me longer than yeah to find them and do that. So we will send them to you. Oh, here's another one, Rachel Barber.
Oh, she's the most local.
Raquel.
Raquel.
Wow, there's a lot of names at GTI.
So, yep, the people who have been in contact with and gotten help from.
Okay.
So that's great. Keep sharing. And again, remind you to, if you haven't joined our Facebook group, please do so. Just remember to fill out the questions at the beginning so we can admit you. And we encourage sharing this kind of useful information about who in GT has been helpful, and various people ask each other all sorts of questions to get advice and help each other.
I have a very minor question. Has there been any talk about the approval lock process? It's kind of a pain for non-family as staff. I'm constantly having to text or email people to remind them to go in and approve lock.
I think we are a ways away from making of that kind of improvement to systems at this point. They got to get the invoice, the best invoices paid. Got to get payroll down to a manageable number of realistic and real errors made by people in themselves. So I agree, it's cumbersome and it's on the list, but I don't see that happening until the other pieces are done. If you guys wouldn't, there's still like 63, so it's probably better just to write your question.
Nina, did you want to say something?
Yeah, I just wanted to respond to that. Maybe Marjorie is taking this into account, but I think it's easier than it used to be, because it doesn't matter who approves and who locks. So if you're doing timesheets, my husband is the one in our family who does the timesheets because I'm staff. If he comes on any that are just submitted, not approved, he just approves them and then shoots off an email to the staff person, remember to lock this. I mean, you don't have to, it's not a two-step process where you tell the person you have to approve it because I can't lock it unless you do. Once you send off that second email, it's in their court. I mean, and you don't even have to send off that email, but it's easy enough to do it because it doesn't matter, who does what, which I find interesting. But anyway, just wanted to.
It is interesting. Yep. There's 3 steps and somebody can do 2 of them.
A lot of people have their employees submit and then approve immediately, and then all the employer has to do is lock it. But my understanding is you have to get off of the app and go onto the actual internet portal to approve it. So it is no matter what, it's a 2-step process for the employee, I think.
Right. You can get to the portal from the app directly. So on your phone, it's very hard to see it and it doesn't auto rotate, but it can be done.
The only way right now for a support broker to help is if the participant agrees and gives them their login information. And that may always only be the way.
I want to thank you guys again.
Thank you all for coming. It's
I couldn't do
wonderful to
this
see
without
everybody here.
SDAN.
Did
Thank
you
you.
see the question, Alicia, that how much attention will be given to the sustainability of the current FMCSs?
I did not. That is a good question. I think at this point, DDA and Maryland Department of Health know how important, what a crucial role the FMCSs play, and they're both heavily involved in fixing things and making it functional. So I believe that it's very much on their mind in terms of keeping them in the state, and eventually we hope they'll be one or more added so that there's maximum choice for participants.
There's another question about when my LTSS will be available, and
that is a great question.
That's something else that keeps coming up in our meetings, and I think that the LTSS system has a lot of issues, and this is just one, for one reason or another, they can't get this completed. So, but it's still on the radar, and it's still something that they say, we're still working on this. It's like,
we have seen evidence that they are working on it, but it is not complete. We'll ask again next Monday and see what time frame we're given.
Well, yeah, and we wouldn't our members to know that, we have an ongoing list of things that we are working with them on, advocating for, that had to take a little bit of a back seat to getting people paid and vendors paid and reimbursements and all that. So, we're on the verge now of going back to our ongoing list of ongoing advocacy issues. So some of those things that you brought up today is also evidence that you're ready, that you're not screaming because your staff didn't get paid Friday. So, that we can maybe go back to some of the ongoing issues that we're working through with the state. That's a good sign, while we're still advocating for everybody to get paid on time.
All right. Well, thanks everyone for coming. We look forward to hearing from you, all the good as well as the evil. Take care.